morning, good afternoon, or good evening to everyone. My name is Huang Wei Ling. I'm a medical doctor from Brazil. I'm very happy to be here today in this World Obesity Conference to share this study entitled, Is there any correlation between obesity and diabetes? I would like to thank the organizing committee for inviting me to this conference also, and congratulate all the presenters from all over the world. Obesity and diabetes have emerged as enormous public health problems, not only in the United States, but also globally. In fact, globally, obesity is a bigger health crisis than hunger and is the leading cause of death and disabilities around the world, with burden is expected to increase in coming years. Both obesity and diabetes are related multifactorial complex disease, and a large proportion of the case are preventable. Both conditions significantly raise the risk for cardiovascular disease and stroke. The first step in preventing these costly disease is an understanding of the reasons behind their unprecedented growth in the past few decades. According to Western medicine, diabetes is a metabolic disease that is relation to elevated blood glucose levels, and obesity is an etiologically complex phenotype primarily associated with excess adiposity or body fatness. This presentation will follow in Hippocrates' oath that said that it's important to consider other ancient medical traditions prior to the knowledge we have nowadays. So I will explain the correlation between diabetes and obesity from the energy point of view according to traditional Chinese medicine. According to TCM, diabetes is considered an indeficiency. You can see that yin and yang are the two energies that exist in all the things in the universe, including our body. And when there is an imbalanced state between these two energies, there is a formation of disease. For example, the diabetes, according to TCM, is formed when there is indeficiency in relation to yang and formation of this internal heat. This is a kind of fire inside the body leading to hyperglycemia. This is another explanation about diabetes, very different from the Western perspective that they understand that diabetes is hyperglycemia. They do not address these energy imbalances that's leading to diabetes. This is Hippocrates that said that we need to understand all these medical traditions. And this is a metaphor of the tree that I usually use in all my presentation, in all my articles, showing the different point of view between Western medicine and traditional Chinese medicine. This tree can symbolize a human being. This tree has a trunk with several branches. Each branch represents one medical specialty, and coming out of each branch, you can see many leaves. Each leaf represents one symptom and disease treated by each specialty. In this case, diabetes is treated by an endocrinology in a leaf level. They are treating the hyperglycemia, and obesity could be treated by many kinds of specialties. In this case, you can be treated by endocrinology or general practice or all medical specialties, but the treatment are in the leaf. But what we can see in this tree, that this tree has a root that is under the earth that usually we cannot see by the naked eye, because it's the energy that is leading the nutrients and energy to this whole tree to to maintain the health of this tree. And this energy is what I will focus on this presentation, that is usually not seen by Western medicine, but is studied by traditional Chinese medicine. And traditional Chinese medicine, they understand that all the symptoms and disease in the leaf level are only symptoms. The problem is not in the leaf. The problem is on the root. And also they understand that this tree has the influence of the external pathogenic factors, including cold, wind, heat, humidity, and dryness, that could lead to the influence and lead to disharmony of this internal energy in the root, and leading to manifestation, diverse manifestation in the leaf level, that we need to understand the whole process to understand what is happening inside the human body that is leading to the formation of this disease. And here is the 5-element theory, is the second theory, the main cornerstone of traditional Chinese medicine to understand all the disease formation. The 5 elements corresponds to water, wood, fire, earth, and metal. And according to this theory, they are explaining that the 5 internal massive organs in the human being has this representation about the 5 elements. The water representing the kidney, the wood, the liver, fire, the heart. The earth element is the spleen, and metal is the lung. And as you can see in this figure, all the elements are interconnected by the energy flow, very different from the Western perspective, that they understand that one organ is working independently and do not have influence in another organ. And this is the main difference between TCM and Western medicine, because in TCM, if one organ is ill, they will have influence in another organ, in all the system. And if one organ is not working properly, we need to treat all the system and not only the organ that is becoming ill. Because if one organ is not working properly, this could be the influence of the other organ leading to this not working properly. And this is the second theory, this yin theory, that is very important to understand, that to maintain health, we need to have the balanced state between yin and yang. This yang and this is yin. But to yin and yang to flow inside the vessels, we need to have the 2 more energies, that is blood and qi, to maintain these energies circulating the entire body. And we need to understand all these systems, because if these 4 energies not work in harmony and not flowing adequately inside the meridians and inside the organs, there will be the formation of diverse disease. In this case, we will discuss diabetes and obesity. And when there is a deficiency of one of these energy or a combination of these energies, there's a formation of a kind of fire inside the body of this patient. And the combination of these energy deficiencies and with this internal fire formation, there will be the formation of the disease in the leaf level of that tree. In this case, diabetes comes from insufficiency in traditional Chinese medicine and formation of internal heat that is leading to hyperglycemia symptoms. And I wrote an article entitled "Why Diabetes Patient is Still Having Hyperglycemia Despite the Use of Diet, Anti-Glycemic Medication, and Insulin," where I'm showing that what Western medicine is doing in the leaf level could not to be controlling the patients with diabetes, because the energy imbalances in the root of this tree is not treated yet. And that is why we need to understand that we need to treat also the energy imbalances in the root of this tree to have the treatment in the root and not just treating the symptoms. And in this case, obesity can come from these energy imbalances. Also, obesity in traditional Chinese medicine came from the accumulation of phlegm and deficiency in the spleen pancreas. That's the fifth chakra that I will show you, and what they have in common. Here is only to show you that obesity came from the accumulation of phlegm, and it's like the lipid in traditional Chinese medicine is accumulation of this phlegm. And here's a case report that I published in this article that I will briefly tell you his history to understand. This is a 26 years old male patient with diabetes type 2 diagnosed in 2016. And his glycemia was about 160 milligrams per dl, and he was receiving Western diet counseling to avoid carbs and sugar. And after this measurement, he didn't, the glycemia only still above 200. And he began to use these kind of medications. And he went to my clinic to do some acupuncture for the stress, because he's a teacher and he was working very much and was stressed. And what I did in his dietary counseling was to avoid the cold water, because cold water in traditional Chinese medicine, one of the cause of causing the deficiency in the spleen pancreas energy meridian, that is causing the accumulation of phlegm and also decrease the absorption of nutrients of what he is eating, leading to less formation of blood. And when there is less formation of blood, will produce indeficiency subsequently, leading to diabetes formation. And that is why we in Chinese medicine, they orientate the patient to drink only lukewarm water in all kinds of the disease, and not only in diabetes, but also in obesity, because obesity comes from this spleen and pancreas energy deficiency that is caused by the ingestion of cold water also. And when you begin to use warm water, you can decrease this spleen pancreas energy deficiency, and decreasing the accumulation of liquid and phlegm in the body, and leading to an improvement of obesity, an improvement of diabetes, because you can absorb adequately the nutrients and formation more blood, and leading to more equilibrium between yin and yang energy. And here's the dietary counseling that in Chinese medicine, to control diabetes is very different from the Western perspective, because in Western perspective, they do not understand that cold water can induce hyperglycemia. But in traditional Chinese medicine, cold water is one of the cause of maintaining the hyperglycemia, because they can induce the energy imbalances, and also the ingestion of dairy products and cow's milk, because these products can induce the spleen and pancreas energy deficiencies, and also the ingestion of raw food can induce energy imbalances, leading to less absorption of nutrients and leading to a worsening of blood and in production. and also sweets and melted cheese. This melted cheese is another problem, especially here in Brazil. I know that many countries and in the whole world, all the population likes to eat melted cheese, but melted cheese is very can harm the production of heat inside the body, leading to hyperglycemia also. And also here is the orientation to avoid coffee, soda, and matcha tea, because all these drinks can reduce the kidney energy that is responsible for yin and yang production. And the yin and yang is very important to maintain health, especially to diabetes and obesity patients, and I will show you why. And here, these foods are the foods that can induce more formation of internal heat, leading to hyperglycemia. And that is why in Chinese medicine, they orientate also to reduce glycemia. You need to avoid fried foods, eggs, chocolate, honey, coconut, alcoholic beverages, and also pepper, cinnamon, and all these spices can induce the hyperglycemia because they can induce the formation of more internal heat. And that's why you need to understand all these foods that can increase the energy imbalances to control better the glycemia of your patients. And here's the second tool that I usually use in all my treatments is the apex ear bloodletting with direct acupuncture to rebalance that, to rebalance that yin and qi blood energies. This is an apex ear bloodletting is a tool in traditional Chinese medicine to take out that heat. And if you use this tool, it's very important tools in all diabetes patients. And I usually use in obesity patients because obesity patients also have energy deficiencies and formation of internal heat. And that is why when you use taking out the heat, the glycemia and the anxiety, all the problems that is generated from this heat will be balanced again. And when you use this auricular acupuncture to treat the internal organs, this 7 is the kidney, this 6 is the liver, this is the spleen, this is the heart and lungs, and this is the large intestine, the anxiety point, and this is the point to sleep adequately. All these points are to bring the harmony between the yin and qi blood to achieve the health again of these patients. And this is the third measure that I usually do in all my patients. This is the chakras energy centers measurement. And this is very important to us to understand that the chakra are the energy centers that we cannot see by the naked eye because they are energy concentrations. But we need to understand that these chakra are like a battery of our organ. It's like a battery of our car, and we have 7 main batteries in our body to emit to send the energy to the organs so they work adequately. The first chakra here is the there is many studies correlating the chakra with the 5-element theory in traditional Chinese medicine, and that's why when I'm measuring the chakras energy centers, I'm measuring the energy of each internal massive organs in traditional Chinese medicine, and one internal organ is responsible for the production of that 4 energies, that yin and qi and blood that they will explain. The first corresponds to the liver, is responsible for this storage of blood and distribution of qi. And kidney is responsible for the production of yin and yang. And in yang yang, and the heart is responsible for the distribution of blood inside the vessels, and lung is responsible also for distribution of qi, and the spleen is responsible for that absorption of nutrients and production of blood. And as you can see in this patient, in the case report 1, he was without any energy in all these chakras energy centers. And that is why I am showing in this presentation that all diabetes patient has this energy pattern, that we need to treat this low energy in this 5 massive organs to they begin to produce again this yin yang, that's qi and blood, to reduce the formation of internal fire that is leading to hyperglycemia. And this is the main alterations in diabetes patients that we need to understand and treat this condition adeptly. And if you treat this condition, replenishing this energy that's very low, the patient will reduce the hyperglycemia very quickly, and he will have more strength, more energy to do their daily activities, and they will be more happy because the glycemia will drop very quickly with this kind of treatment. And the treatment of this condition, I usually use this another theory that I wrote in 2015 when I began the homeopathy course, because in China, when the patient has energy deficiencies in the internal massive organ, depending on the type of deficiency, if yin or yang or qi or blood or a combination of them, there are so many kinds of Chinese herbs to be used. But here in Brazil, it's more difficult to find this kind of medication, but we have, but it's more difficult. And I began to study homeopathy, and during my course, I wrote this theory linking homeopathy with traditional Chinese medicine. In my opinion, homeopathy is a kind of Western traditional Chinese medicine, is a Western Chinese medicine. And that's why nowadays I can use homeopathy medication to treat this condition of lack of energy. I will show you why I'm using homeopathy and not other kinds of medications, such as allopathic medication or other Chinese herbs, because of this energy pattern. Depending on the energy that the patient has, you cannot use some types of medication that I will show you why. And the result of this case report is that in the beginning, his glycemia was about 700. And after this procedure, replenishing and doing acupuncture and changing all his diet, his glycemia was around 150. And this another second case report is a 55-year-old woman with a history of diabetes, hypertension, hepatic steatosis, anxiety, and overweight. And she was using 26 pills a day for the last 25 years to treat all her conditions. And after developing this chronic liver disease due to excessive medication, with fear of having to have a liver transplantation, she started trying to lose weight. She was weighing more than 100 kilos, but a little more than a year she underwent a bariatric surgery. She was weighing 150 kilos, and she lost 50 kilos after this surgery. And when she went to my clinic, I did the same diet orientation, and did the same auricular acupuncture, and this is her Chakras energy centers measurement that show that all her internal energy were in the lowest level, showing that the obesity and diabetes patient has in common this energy deficiency. And in traditional Chinese medicine, what is leading to obesity could be the spleen and pancreas deficiency, leading to that fat accumulation. The fat accumulation is in reality is the accumulation of phlegm. And the phlegm is caused by the ingestion of cold water, raw food, and sweets and dairy products. And all these foods are very common in Western cultures. And that's why in this case, because to reduce obesity in Western medicine, they usually orientate the patient to eat more salad. And salad is a kind of raw food that can induce the spleen and pancreas energy deficiencies and can maintain the obesity. And that's why you need to orientate the patient to do not eat raw, but you need to cook or to steam the food, to do not to give raw, and also avoid dairy products that can induce the formation of phlegm, and also orientate the patient to drink only lukewarm water instead of cold water, because cold water can induce the formation of phlegm and induce the increased weight and obesity. And all the organs are interconnected. And when you treat one organ, you need to treat all the system, because all the systems are very sick, weak in energy, and one organ depends on the other. And to treat the spleen and to treat the kidney, we need to treat, because the spleen, it receives energy from the heart, and the heart receives energy from the liver receives energy from the kidney, and kidney receives energy from the lung. All the organs are interconnected. For this reason, you need to treat all these conditions of this patient to the organs begin to work properly, to reduce the formation of phlegm, to urinate adequately. And usually patients that has blood deficiency has constipation, and patients that has obesity, you need to. And constipation in Chinese medicine means blood deficiency that comes from these energy imbalances. And that is why all the things are integrated. You need to treat all the systems to achieve one of the symptoms, because diabetes and obesity is only the symptoms, but the real cause are these energy deficiencies that we are not treating nowadays, that we need to understand, that we need to treat the root and not only the symptoms. And here are the alterations in the second chakra, is the kidney, liver, leading to, when this chakra is not working properly, the patient will not urinate adequately. The volume and the strength and the force of this urine will be very weak. And when you begin to treat these energy deficiencies, the patient begin to say that the urine is more increasing volume, and the force of this urine is very much increased, and they became to urinate better, and only doing these things to balance all this energy that's very weak, the patient begin to lose weight and reduce the glycemia, because they came from the same root. And these are the production of blood is compromised, because the absorption of nutrient in the fifth chakra is not absorbing, because do not have energy to absorb, to formation of blood. And the third chakra, that is the heart, is not working properly. And this pattern of energy is not only in diabetes and obesity. This pattern of energy is in the majority of patients nowadays in all chronic disease. According to one study that I did in my clinic during 2015 to 2020, a study more than 1,000 patients, chakras, energy centers, showing that we are in this lowest level of energy nowadays, including us, medical doctors, because this could be the influence of the electromagnetic radiation and wrong eating habits, and also the use of metallic implants and many other things that we are doing that is reducing this energy in our body. And here's to show you that the Qi is one of the energies that is distributed by the liver and the lung, that when this energy is low, you can see that the blood to flow inside the vessels, there is the necessity of having these four energies in an adequate amount. And when there is energy deficiencies in these four energies, you can have the formation of blood clot. That is why, as I show you, when the patients nowadays are receiving vaccines for COVID-19, they are having blood clot because these energy are very compromised, because all these four energy is not working properly in the majority of patients, including us. And that's why the treatment of obesity and diabetes means to replenish these organs to there to working properly, to improve these four energies, and to achieve health, reducing hyperglycemia, and decreasing the formation of phlegm, and improving the energy of all these organs that is very low. And this is the research that I did in my clinic, showing that all the patients in all age groups, including babies, children, adolescents, young adults, and older patients, independently on the diagnosis they have, if they have anxiety, depression, knee pain, or headache, or panic syndrome, or diabetes, or myocardial infarction, or cancer, or many other diseases, they have in common these chakras, energy centers deficient in energy. And nowadays, patients that are acquiring in COVID-19 infection, also the predisposition to have this is these chakras, energy centers, because energy means our immune system. And when this energy is low, our immune system is very low. And in another article that I wrote, entitled, Are We Vaccinating Immunocompetent or Immunocompromised People for COVID-19? I'm showing that the majority of our patients in the globe are in this pattern of energy. That is why I think we are not responding very well to these vaccines, because we need now to have the third and the fourth shot of the vaccine to maintain the antibodies. That's very weak, because the formation of antibody is made by this fifth chakra that I'm showing you, that the majority of patients do not have energy to produce antibody and blood. And here's to show you that the obesity is only the diagnosis in Western medicine, but what are in the root can be caused by a diverse energy imbalances. For example, the major energy imbalances found in this research is indeficiency in obesity patients, but they can have a combination of energy deficiencies, such indeficiency with the blood deficiency, yin and yang deficiency, yin yang qi deficiency, and internal heat, and a variety of combinations. And when you do some research in obesity is a general diagnosis, but what they have, you need to separate between these energy, the same energy imbalances, because the same patients with obesity could have many energy imbalances, different energy imbalances, leading to the same diagnosis in Western medicine perspective. Also in diabetes, diabetes is only a diagnosis, but at the root, there are so many energy imbalances that are leading to diabetes. The main energy imbalances is Qi deficiency with heat retention. But when these patients do not treat this condition, this will transform in another energy imbalances or yin and yang and Qi or blood deficiency and heat retention. And depending on the time that you are treating these patients, some patients could have a combination of all these deficiencies leading to diabetes formation. And this is the treatment of these energy deficiencies in the 5 massive organs that I usually use homeopathy medication that I will explain to you why it's necessary to use homeopathy instead of high concentrated medication. And if you treat this condition using this medication, you can search this study. It's on the internet. The liver, you treat using phosphorus. The kidney, you use natrium muriaticum. To treat heart, you use sulfur. To treat the lung, you use silicia, and spleen calcárea carbônica. But you need to give this medication according to this generation cycle. If you begin to treat the kidney, you begin to treat natrium muriaticum. After, you need to treat the liver with phosphorus, and after, you need to treat the sulfur, and after, you need to use calcárea carbônica, and the last medication is the silicia, because you need to give according to the generation cycle of this element. What is causing this lack of energy in all my patients and possible all people around the world could be the wrong eating habits leading to less absorption of nutrients of the spleen and pancreas, and the use of cold water is the major problem, and the use of dairy products, very common in all countries nowadays. And what is leading to kidney energy deficiency is the ingestion of so much coffee, soda, and matcha tea, very common in all countries. And the use of the electromagnetic radiation nowadays that is disseminating the whole globe, leading to reduction of this energy in our body, and leading to, because these energy alterations is not usually studied because it cannot prove by the laboratory exams in the first years of alterations. And they can only appear in the laboratory level only after 5 or 10 years of alterations. And this phase where Western medicine is doing the diagnosis is a very late phase, because you lose 5 or 10 years of energy alterations to treat these patients adequately. And that's why in this presentation I'm showing the necessity of treating these patients in the energy point of view before leading to energy laboratory alterations. And here is another article that I wrote in 2019. Can biomaterial surgical implants influence the body's health? I'm showing in this article that these metallic implants can reduce the vital energy, leading to more propensity to have the majority of chronic disease nowadays, such as diabetes, myocardial infarction, hypertension, and cancer, etc. And that is why we need to understand and develop other kinds of materials that cannot induce these energy deficiencies. And this is the Arnold-Schultz law, explaining why we need to use high diluted medication. This is when we use high diluted medication, the vital energy of the patient will improve. And when we use high concentrated medication, is the kind of medication that Western medicine is using nowadays, you can worsen even more this vital energy. And that is why the type of population that we have nowadays is very different from the type of population that we have 7, 8 to 10 years ago, because of this influence of the electromagnetic waves in the entire body, mainly the 5G technology, and leading to this less energy state in the whole human body, and leading, and when you use this high concentrated medication, you can reduce even more, or leading to the lethal dose. And that is why the type of medication that we need to use will depend on the type of population that we have nowadays. This was another theme that I presented in the beginning of this year in another webinar, showing that to know which type of medication we need to use in a patient, we need to know which type of population we have nowadays. And the population we have nowadays are very weak in energy, and that is why the use of high concentrated medication should be avoided, and the use of high diluted medication is the best choice nowadays. To understand diabetes, obesity, in the deepest level, we needed to integrate Western and traditional Chinese medicine to understand what is materialized energy and the not materialized energy in the root level of that tree, that they are the same. One is materialized and the other is not materialized energy. And the conclusion of this study is that obesity and diabetes has the same root as the problem, that are the energy deficiencies in the chakras energy centers, and the treatment of this condition, replenishing the chakras energy centers using homeopathy medications according to that theory, constitutional homeopathy of the 5 elements. We're treating both conditions at the same time and with success. According to Hippocrates, natural forces within us are the true healers of the disease. And that's why we need to balance this internal energy to achieve health in all kinds of treatment, and not only in diabetes and obesity, but all kinds of treatment needs to be, you use this kind of therapy, including infectious and non-infectious disease. Thank you for your attention. If you have any question, I will be very happy to answer it. Thank you.